Good evening. Welcome everyone to the LGBTQ mental health town hall here in San Luis Obispo County. Just a few quick housekeeping. First of all, my name is Elisa Feld. I am a San Luis Obispo local and a former member of the LGBTQ Mental Health Equity Task Force, and I'm really excited to be here with all of you tonight. Just a few housekeeping as we get going tonight. If you are in need of support, we have listed several services in the chat box. We'd really like to thank Lindsay and Mala, our American Sign Language interpreters, for the evening. And you will be able to see them throughout the evening translating this town hall. Just so you know, we will have a few points during this town hall to answer questions, which you can put into the chat. So we will have time at the end of Dr. Better Garcia's presentation to answer your questions live. And then again at the end of our panel presentation. There's a Q&A feature located in the toolbar at the bottom of your screen, and questions may be asked throughout the evening there. We will answer both live and in the Q&A box. And please use the chat box for any technical support. So with that, just to kind of give a brief overview about why we are here tonight. So this task force started, gosh, a little over 2 years ago here in San Luis Obispo County, and was a part of the original #OutForMentalHealth initiative that was happening up at the state level to really build infrastructure surrounding LGBTQ and mental health. And San Luis Obispo was one of the first of 5 counties to receive support for this task force. And you'll be happy to know that now I believe there are up to 20 different counties within the state that have a similar LGBTQ task force. So this would not have been possible without some very strong advocates that I would like to name really quickly. Ellen Sturtz, Doug Hoyman, Michelle Call, and Barry Johnson. All of these individuals were so key in helping us bring this to San Luis Obispo. So a quick outline of the evening's activities. We are going to be hearing from Dr. J. Better Garcia regarding the results of the LGBTQ mental health needs assessment. And then we're going to be hearing from Michelle Call regarding the LGBTQ mental health equity task force and how you can get involved. We really want to hear from the community. And following that, we will be hearing from a panel of some of our task force members, giving you information about their agencies, inclusive and affirming services. So we have over 100 people tuning in tonight, and we want to thank you all for being here. We're going to do our best to get to everyone's questions, and there will be many opportunities to get involved and give feedback moving forward. So with that, I want to introduce Dr. J. Better Garcia, who is a fabulous human being, if you don't know them already, a psychology professor at Cal Poly, who also leads the Queer Community Action Research Education and Support Research Team at Cal Poly, Qcares, whose team who led up to the LGBTQ mental health needs assessment of San Luis Obispo County. This was the first of its kind to really do an in-depth dive into where we are doing well as a county when it comes to supporting LGBTQ individuals with their mental health, and where we might have some more work to do. So with that, I am going to hand that over to Dr. J. Better Garcia. Thank you.
Awesome. Thank you so much, Elisa. And thank you so much for having me, everyone. I am excited to share these results with you. I will also say that in addition to Elisa's awesome shout out of me being an awesome human, so is she. The results I'm sharing tonight are results that she worked really hard on and really led the effort to put together so much of the report that we published at the end. So thank you, Elisa. So I'm going to try to figure out how to, let's see, share my screen. Here we go. And I'll go presenter view. All right. Can you all tell me if you can see, what do you see right now? Everything? You see all my bottom slides, all my notes?
Yes, Jay, we can see it all.
Let me see if I can change that share then. Let's see, share screen.
I don't think we were seeing notes, just the slides.
I think this will help. How does that look? A little bit better.
That looks great.
Cool, thank you. So this is our 2019, which feels so long ago. 2020 was such a rough year, and 2019 just feels like decades ago. So, but it was only a year and a half or so ago that we actually came out with this data for the mental health needs assessment. I'm Dr. J. Beta Garcia. I use they, them pronouns. I'm an assistant professor at Cal Poly in psychology and child development. I identify as queer and transmasculine, non-binary, and I'm super excited to share these results. So as Elisa mentioned, this is the Queer Community Action Research Education and Support Program, Qcares. You can see our logo down here at the bottom. And the goal of Qcares is to really look at using research as a tool to facilitate queer and trans affirming training, support, and policy change. And it's important for us to think about the needs assessment report as not a final product. It's not the output, but it's actually the input for all the next steps to come, right? And so the report is a starting point for all the next steps, all of the things that are happening now with the strategic plan and all these initiatives. And so the strategic plan, as we'll hear from Michelle, really helps move this data into action. This is a picture of me and some of my research team members. So many of these folks have graduated and moved on, and I get a new set of and cohort of folks. But these are the folks who really helped with this needs assessment. So what is the needs assessment? We did a mixed method, which means we used qualitative and quantitative. So data that was numbers and data that's people's words. And it was a needs assessment to study the mental health needs and the barriers to care for queer and trans folks across San Luis Obispo County. We did an online survey and then 6 focus groups. We had participants from the age of 14 and up. And so we were able to make a case for why it was important to have youth involved. And our ethics review board agreed and said, yes, it is really important that queer and trans youth voices are heard in this survey. And then we also had adults 18 and over. We focused on San Luis Obispo County residents. We did have some people participate from Santa Maria. We know that our lines are blurry, especially down on that Santa Maria and South County lines. People work in one area, live in another. And so it was important for us to open that up. But I will say that most of it's from San Luis Obispo County. And the data collection was spring of 2018 to spring of 2019. So not that long ago. So this is the front page of the report. This is the report that Elisa really spearheaded to create and make this beautiful report that really gives us the numbers in hopefully a little bit of less dry way. Lots of charts and graphs and pictures and lots of ways to get into that data. The full report is available at queercares.com, and I'll share more about that as we go. The graphs that I'll be sharing today are actually straight from the needs assessment. So whatever you see here, you're like, hey, I'm curious about that, or I want to see more, it's all in the report. So one of the first questions we had were, what are the barriers to seeking services? What's keeping people from seeking mental health care in San Luis Obispo County? And here I'll orient you to this graph. So this red is things that people said were always a barrier. And then on top of that, we overlay sometimes a barrier, right? People said these are the things that are sometimes a barrier. So I'm going to highlight for you the ones that are LGBTQ plus specific. So 68% said that they didn't know how to find an LGBTQ competent provider, right? That was sometimes or always a barrier to care for them. 62% said they couldn't find a provider they're comfortable with who's LGBTQ knowledgeable. That was always or sometimes a barrier for them. They were concerned that the provider wouldn't be supportive of their LGBTQ identity or behavior, or they had no LGBTQ knowledgeable mental health services offered in their neighborhood, right? 60% of folks said that was sometimes or always a barrier. In between, you'll see the things that are barriers for lots of folks, right? Can't afford services, wait times are too long, ashamed and stigma about seeking services, and this harmful or traumatic experiences with past mental health services. We know that those pieces, the ones I highlighted were LGBT specific. The others are things that affect lots of folks for lots of different reasons. But we also know that that affects queer and trans folks specifically when they can't find the services, when they can't afford the services, the wait times are too long, they're ashamed, right? So all of those things compound to show a picture of what are some of the barriers that are existing for our clients or our folks who maybe aren't even clients but need support and aren't getting it. So we also asked, okay, we know that there are barriers to care. What are the support services that we need? And these are the top 5, but we have a whole list in the report. But the top 5 services that were needed to better serve the queer and trans community in San Luis Obispo, we see that in the red, things that were a high need, and then in the orange, things that were a moderate need. And when you compound that together, you see that quite a few folks are saying that LGBTQ focused sex ed, services for people without insurance, trans-specific services, low-income services, and LGBTQ affirming mental health services, right? So these are the top 5 things that our community members in in San Luis Obispo County are saying that we really need to focus on if we're going to do a better job around mental health and wellness. And these are the ones that are more specifically about queer and trans barriers. But we also know that queer and trans folks without insurance or needing low income services, that these are compounding variables that keep people from seeking care. So we also measured distress. We wanted to know how folks were doing in terms of their anxiety, their depression, their distress. And so this is one of the measures that we used. And to orient you to this one, this is the question up here. % of participants who felt blank, so nervous, hopeless, restless, most of the time or all of the time in the past 30 days. Here we have the approximate percentages for trans and non-binary folks for each of these items. And then LGBTQ, so that's sexual minority folks. So lesbian, gay, bisexual, queer, and questioning, separated out from gender identity over here with trans and non-binary folks. So here you can see that across nervousness, hopelessness, restlessness, depressed, everything's an effort, worthlessness. What you can see from here is that across the board, our trans and non-binary folks in our community are significantly more distressed than our queer folks or sexual minority folks. So here you say like nearly 60%, each of these is higher than the one next to it. So we know that our our trans folks are just more distressed across the board. When we look at the severity of the distress, right, lots of us are distressed in lots of different ways for lots of different reasons. But when we actually break that up between low distress, moderate distress, and high distress, we see that here in the blue, trans and non-binary folks are lower on low and moderate, but much higher over here when we talk about high levels of distress. So not only are they distressed more often, they are in higher levels of distress across the board. So here, this one is, there's a lot on here, so let me walk you through it. So this is when we looked at distress and then we looked at suicidality, we had this broken up by age range because we know suicidal thoughts and ideation look different across different age groups. And so especially for our youth, so our youth are in the red here, 14 to 17-year-olds. The orange are our young adults. And then yellow, 25 to 40, green, 41 to 64, and then blue, 65 plus. So here we have the question, if someone has seriously considered attempting suicide in the past 12 months, and what we see across all of these is that our red line, which is our youth, 14 to 17 years old, are consistently higher on each of these, followed closely sometimes by our young adults. So 52% of our queer and trans youth have seriously considered attempting suicide in the past 12 months. We found that in our data, but we also know that from the California Healthy Kids Survey that is not, that's not just our data. I think they found like maybe 49 or 50%, 51%. So very similar numbers. We're seeing that this is across multiple data sets that our queer and trans youth are really considering suicide over the 12-month period. We also see, having thoughts of killing themselves. Lots of folks have thoughts. And so we can see that these numbers are much higher. And then we say, folks who have made a specific plan without carrying it out, who have made threats that they're going to kill themselves and then have tried to kill themselves. We see that the numbers across are much higher for our youth and our young adults. When we think about the connection to the community, we look at this one. And again, you can take a look at all of these items in the report, but I'm going to highlight a couple. So this idea that most LGBTQ people feel safe in our community, only 30% of queer and trans folks say that that is true, right? Which means that 70% of people don't agree with that statement, which is a huge problem. When someone moves here, people make them feel welcome regardless of their identities. Again, pretty low numbers. And so this just tells us how connected people feel in the community. And these numbers say that not everyone is feeling disconnected, but there are lots of things that we can work on. So next I'm going to talk about minority stress model. And this is the idea that, if we're talking about health disparities, mental and physical health disparities that we see with, why are our queer and trans folks feeling more depressed, more suicidal, more anxious? It's not a factor of having those identities, but it's what those identities mean in context of our society. In our society, we see that prejudice, stereotyping, and discrimination are huge, right? For queer and trans folks, for any marginalized, minoritized identity groups. When you add to that self-stigma, isolation, identity concealment, these internal pieces, you get more mental and physical health disparities. So that's the framework for which we're going to understand this next piece, which is vigilance and vicarious trauma. So participants responded to these questions, and here we see watching what you do and say around heterosexual people, right? That most queer and trans folks are saying, yes, I'm careful, I'm cautious, I'm vigilant. We also see that hiding part of your life from other people happens for 60 to 64% of our participants. Vicarious trauma, so this is like hearing about other folks being called names, hearing negative things, seeing our legislation that's negative against queer and trans folks. So those are the kind of things that lead to vicarious trauma. And here we see, again, across the board that our trans and non-binary folks are much higher, kind of across each of these areas. They're not low for our queer folks, but they are much higher among our trans population. So hearing people make jokes, hearing people say negative things, that causes this vicarious trauma for folks. In terms of internalized stigma, so the stigma that we have kind of internally that we feel, that we hold on to, we have things like this. So this is internalized transphobia. So this is specifically about folks who are trans or non-binary or otherwise gender diverse. And you see things like, because of my gender identity or expression, I feel like an outcast. I often ask myself, why can't my gender identity or expression just be normal? I feel that my gender identity or expression is embarrassing. And I envy people who do not have a gender identity or expression like mine, right? So that's an internalized shame and stigma that people carry. In terms of heterosexism, we see similar things. Because of my sexual orientation, I feel like an outcast. Or I often ask myself, why can't my sexual orientation just be normal? Again, these numbers aren't as high as some of what the other pieces that we've seen, right? But still, we're creeping up here to 25 and 30% of folks walking around our communities feeling that way, right? So in addition, we also ran some focus groups. I'm not going to go in depth on these. These are all in the report, but these are the main areas that when we looked at the data across everything that people said, these are the main themes that came out. There are barriers to accessing mental health care, and they talked about those. Conditional feelings of safety, right? Based on my identity or what area of the community I'm in, I might feel safe. I might have some conditional feelings of safety. The need for supportive spaces, and this was supportive spaces that were formal and informal, kind of hangout places. There are both positive experiences shared and negative experiences, and then gender identity specific experiences, right? We heard a lot about, this is something for our whole community, but in particular, trans and non-binary folks are dealing with these things. I'm going to actually move through these because I don't think we have time to get through all of these. Let me just move forward. I'm just going to move us to recommendations. So based on all of this that we heard and that we learned, can I get a time check? Actually, I want to make sure that where we're at.
Jay, you have about 4 more minutes.
Cool, thank you. So a recommendation. So we had a list of recommendations, and here are some of them. Organizations and agencies should attempt to identify areas for growth and change to support our queer and trans mental health and wellness across San Luis Obispo. So routine self-assessment across our agencies, right? We need to understand the climate of these agencies, how they're treating those that they're serving, and also their employees. We see that we need the implementation of policies and practices that are inclusive, and we make sure that we comply with state, local, and federal law. And we also need liaisons to make sure that these things are actually happening, right? Like, are these policies and practices actually going into effect? We need more training. We heard over and over again that that folks just weren't well enough trained, that people had a little bit of information, but not enough. So increasing awareness about providers' beliefs, about heterosexist or binary or cis norms. We also heard a lot about that, my therapist is friendly and they're a good person, but like they don't know what they're doing with my gender identity, right? So not only do they need to be friendly and supportive, but we need providers across our county who are knowledgeable, aware of their own biases, and skilled to do this work. We also know, as I highlighted, that our trans and non-binary community members are in need at higher levels than other parts of our community. Providers are rated as less knowledgeable and affirming across the board than they are, queer folks are like, yes, our providers need more knowledge, but our trans folks are like, oh my goodness, our providers need more knowledge and need to be more affirming. We also see that our trans folks report more negative mental health outcomes across the board, as I mentioned before. And our trainings, I think sometimes our trainings are well-intentioned and sometimes focus maybe quite a bit on queer issues, but not always as much on trans or non-binary issues. Not always. I mean, we do lots of trainings and lots of folks in the community do lots of trainings that do focus on trans issues. We just need to make sure that that it's being covered and that we're getting enough focus there. We need suicide prevention efforts that purposefully include folks in our community, and outreach and crisis services that are targeted and tailored, and also trainings for our suicide prevention folks who are doing this work and making sure that we have LGBTQ folks in mind when we're making these decisions. More support services for youth, really an increased focus, and that support groups and safe spaces, that we need more of these. And I think this has changed quite a bit since 2019, but then COVID happened. So we'll have to make sure that our youth are getting the services they need. And then we need more spaces. People talked a lot about like, I love Gala, but we need more. Or I love the Pride Center at Cal Poly, but we need more. We need more spaces. And I think this is just something we hear in an echo chamber over and over and over. And we know that community connectedness buffers this, the relationship between stigma, depression, and then suicidality. So if people can feel connected in their community, they're less likely to have these negative mental health outcomes. Resource and staffing for these, please. And when folks are supporting the community, this should be displayed prominently. We also need a database. I think we'll get to this. We're working on it, and we'll see what we can come up with. I'm curious to see what's in the works. I know for the training that we're doing right now, we're going to put all of the names on the Qcares website, and so that'll be one spot, but we just need more ways for folks to find providers. I know I'm probably like up on time. I will say that as a little teaser, part of this was, the goal of this was to get this data and then put it back into the community in things like the town hall, like today. But also we have these fun infographics that we will be launching, that you'll be seeing on social media and on the Qcares website, that the students have just worked so hard to take all this data and put it in these really graphic, fun like posters and social media posts. So you should see, if you're following Qcares on Facebook or on Instagram, or you check out our website, we will have all of these posted. These are in PDF form so that when we're in person, you can actually print them and put them up places, but also we'll have them on social media. So with that, thank you so much. These are all the folks who were community liaisons, community organizations, and then folks on the team who just helped make all this possible. Well, thank you.
Thank you so much for that, Dr. Better Garcia. It was so such a great reminder. I refer to that report all the time, but to hear it, to hear all of the findings again, is just, it seems that, we know this was done pre-COVID, that these findings are just going to be even more important and are probably much, much higher. So a few questions in the chat. Can you remind folks how many participants you had in the study?
Yes, I can. I think I glossed over that because I knew I was like, I have like a 30-minute presentation. I'm shoving it to 20 minutes. So we had, let's see, I'll get to that part right now. It ended up being just a little under 100 for trans and non-binary folks, and about 300 or 400, I think, for, like 350-ish for queer folks. So LGB and Q. Yeah, that number looks, let's see. Yeah, so we had 438 take the quantitative survey, and then 34 people participated in the focus groups, which were more intense and in-depth for 2 hours.
Thank you. So we have a few questions wondering if this data has been compared to any other data. So can you speak to, like, are there any similar studies to compare these statistics to non-LGBTQ groups? I don't know if in SLO or if other studies, either state or nationwide, have been done.
That's a really good question. That's something that when we were designing the study, we're like, should we include everyone and compare? And we really just decided to focus on queer and trans folks. I'm not sure. I know the California Healthy Kids Survey has a lot of stuff around youth and youth mental health. And so that is comparable, with, because they can break out that data. I don't know about any other, and I don't know if maybe others in this community and this call have done surveys like this with the whole community and know what our numbers look like across the county, because I don't. But I would love to see a comparison. If anyone has that data and wants to do a little data dive with me, I'm a data nerd, so we could definitely do some of that work.
And we had one question wanting to know if you could add any more to what your analysis was surrounding participants' race, ethnicity, and their abilities, and how that intersected with their LGBTQ identities, and how that ultimately impacts their mental health.
Yes. I wish I could show you the slide. I could pull these slides up and take over for a little while longer. But yes, we had our demographics in terms of age, gender identity, sexual orientation, race and ethnicity, income. We had lots of different variables around demographics. It's all in the needs assessment, so I'll point you there for a quick answer. But a slightly longer answer is that yes, we do know that these marginalized and minoritized identities intersect, and we know that our lower income queer and trans folks struggle at higher rates. We know that in general, and I don't know about this data in particular because I haven't done that analysis, but I know that in general, what we see is that our BIPOC folks who are also queer and trans face more barriers, right? And so when you think about finding an affirming provider who's like, hey, I'm queer, I'm trans, and I'm trying to find an affirming provider. I also am Black or Latinx or Asian American, or I have a disability. I want you to understand those parts of my identity. You can just imagine that not all of our providers in town might know how to manage all of those pieces or understand the intersections of racism and heterosexism and cissexism and all these pieces. So we do know that the intersections of these identities are places for great strength and great resilience. And they're also spots of, more marginalization and more minority stress. So.
Yeah. You touched on this a little bit about adding providers to the Qcares website. Can you speak a little bit to the training that you are doing for mental health providers?
Thanks, I sure can. So we are doing the SLO acceptance program. It's a county funded training program, part of the innovation funds with the county. It's a 4-year project to train our therapists in town on LGBTQ plus affirming mental health care. And so we've done one cohort last year and they went through the whole training. It's 9 months long. They go through multiple weekends of training. And then in between they have consultation groups, which for therapists is just meeting with other folks who are also doing this work, also going through this training, and an expert in this area to really talk about their cases, talk about how they're using the training and putting it into practice. And so this 9-month training, as if you can imagine, like maybe I've trained some of you for 4 hours or 6 hours or 8 hours through some of our training programs. this really lets us go and do a deeper dive for 9 months to get people the knowledge, awareness, and skills that they need to do this work. So we graduated about 30-ish folks last year, and we have another group of 30 to 35 going through the program right now. And the idea is that if we can get these people's names up on our website, that we can, hopefully increase people's access to folks who have been well-trained.
Thank you for that, Dr. Better-Garcia. Going back to the needs assessment, has there been any talk, or do you have any ideas if this will be repeated, particularly following this pandemic? And
yes.
What might that look like?
Yeah, so from the beginning, we thought maybe we would do like a every 5 or so year kind of check-in. We have it, it's ready to go. I think a lot of the labor goes into the front end of, putting a survey like this together. But now it's there. We can put it out whenever we want. And then the hard part is just getting people, to take it, or getting people to come to focus groups. And so I think it'll be interesting. That would put us at like 2024, but, we'd really start that effort in 2023 to then launch it and get some more data. So if we could do like a every 5 years kind of check-in, like how are we doing? How does this compare? I think it would show us across time, what are the trends, right? What are we seeing? Did we make any progress in any of the areas? Training 60 clinicians, did that improve anyone's access to care? You reduce their barriers to care. And we know so many programs are happening in town. So how do all of our cumulative efforts affect mental health and wellness for our communities? We really need more of these drop-in points with this data set.
Thank you so much, Dr. Better-Garcia. I think that I will add one more question about the data that has come in. And I apologize if you touched on this, but if you have, maybe to expand a little bit on how their socioeconomic status intersected with their LGBTQ identity and how that might impact their mental health.
Yes. So we haven't done a deep dive into each of the demographics to see what are the intersections specifically, but we do know in general, and I'll share this slide, a portion of my screen. All right, so let me see if I can make this a little bit bigger for you all. All right, I'll go this way and maybe show you this piece. Oops, wrong one. All right, y'all see that a little? It's a little cut off. Okay. So here you can see the household income, and you see that there is kind of a bimodal distribution, which just means there's 2 humps here. There's kind of a group that's down here, and these are like 10 to 20,000, 20 to 40,000, 40 to 50,000. And then there's this other bump over here on this side with 100 to 150 and then 150 and more. And I realized that for our community, we could have broken this up more, 150 and more. We could have done more chunks. It's important to remember that not all of our youth always know what their household income. They're kind of guessing, or they're like not sure. Or a lot of our college students might be like, well, is it mine here at college or is it my parents? And so it's unclear. I'd have to do a little bit more digging to see if this hump down here, how many of those are our college students who are reporting like, hey, here's how much I make on my part-time job, versus people who are making that as their household income, and they're not, maybe also relying on their parents in some way. So it's tricky to understand this piece without a little bit of a deeper dive, but that's what we see there. Yeah, I could go on forever with this stuff, but I will stop there.
Thank you, Dr. Better-Garcia. And as a reminder, I believe someone put it in the chat of where you can find this full report. It is on the Qcares website, and we will drop it in the chat again. And for all of those that registered, Caroline Sarusi with Timo will be sending up a follow-up email that has all of this information and contact information if you want to reach out to Dr. Better-Garcia and talk data even more, because they would love to do that.
I would. I mean, we have employment, relationship status, location. We have lots of stuff. So I'm happy to do more later.
Thank you so much. I just want to, again, express my thanks, Dr. Better-Garcia, for you being here tonight, for you sharing these results, and ultimately really being a strong stakeholder in the Mental Health Services Act Advisory Committee to really make this happen. This was not a solo effort. This was a community effort on so many parts. So I just really want to say thank you for your leadership and to others who helped make this happen.
Yeah, it definitely, it takes a big group of folks to push forward efforts like this. Definitely not done as a solo effort. There's so many folks who I see on this call and some who I don't, who are so instrumental in making some of this stuff happen. So thank you all.
Thank you. And with that, we are going to transition to one of those folks, Michelle Call, Executive Director of the Gala Pride and Diversity Center. I will hand it over to you.
Hi, and thank you so much, Elisa. So Caroline and I actually were splitting this duty a little bit. Caroline was going to talk about the overall strategic plan, and then I'm going to highlight one of the goals so that we can really get a little bit more in depth about one thing. But I think we have a video to show you first. Are we starting with the video first, Caroline?
Yes, we can go ahead and start with the video.
And do you want me to play it?
Yes, please.
All right. So we just wanted to illustrate some of the things that Dr. Beta Garcia found in their report. So we were able to speak to some local people. And I'm just realizing that I need to stop this for a second because I looked up the GSA thing and now I'm on the wrong screen. Okay. Do you have sound?
We do not have sound.
All right, one more time. I apologize. I have done this before, I swear. I went to therapy because I was having issues around PTSD, around a very specific traumatic experience in my life. This experience had nothing to do with gender or sexuality in any way, shape, or form. And I chose a therapist who was listed as LGBTQ plus friendly in the health insurance profile for him. And so this is somebody who advertised himself as being friendly and accepting. But when I actually went to start therapy with him, he basically found a way to relate everything that I was going through to my sexuality. When I would go in and start talking about this traumatic experience that I went through, he always found a way to reroute the conversation to something along the lines of, well, and you told me that you are also bisexual, and I feel that this is a way for you to rebel against your parents, even though my parents were actually very accepting around my bisexuality, and I don't understand how that would be rebellion when they were so accepting. I also had to redirect common misconceptions around things like bisexuality and polyamory in every session. Every session he would bring up, oh, well, and because you are bisexual, you also, seek out threesomes or are sexually promiscuous. And every session I had to tell him, that's not what's true for me. That's not how I am living my life. And it was very pervasive, even after correcting him. I think I lasted about 2 months before I called and canceled our sessions. But I just have so many memories of going into that office feeling good about the thing that I wanted to talk about in therapy, and then leaving feeling significantly more anxious and sometimes even frankly depressed about who I was and why I was there in the first place than I had when I came in there. And so that experience really made me feel like maybe therapy wasn't the right option for me for quite a long time. I really had to kind of be reassured that I could find affirming therapy before I felt comfortable seeking that out again.
My story is I went to one of the medical offices in Soul County when I was getting hired for the position that I hold currently. And when I was in the office, I had asked the doctor if we could close the door so that I could have privacy when we were discussing everything that we needed to. And I was assured no one could hear me. I was talking with them and asking, is that something in which we can do just to make myself feel more comfortable? And again, there was a sort of power-based situation where that individual said, no, this is something that it should be fine. Let's move forward. This is just real quick. The questions I need to ask you. And so in that moment, though I wanted to get the appointment done and over with, I also felt uncomfortable that my wishes as a patient and just the needs in regards to confidentiality weren't being respected by the medical professional at the time. During the actual session with the doctor, they were asking me questions, and it got brought up what type of food I eat, and I'm plant-based. And so something that was a little alarming was that one of the nurses way down the hall had overheard that because they had heard our conversations because the door was open, and after had greeted me and talked to me, was super kind. Mind you, you couldn't help but feel that that's the kind of situation we were trying to avoid. But it is something that I hear a lot of stories within the community, from other community members, as well as from other individuals that have had poor experiences with medical professionals out here, that a lot of times their wishes are not being respected. There's a sort of authoritative, this is how it's going to go, and you should be happy with it, or you should be grateful you're here, rather than understanding that in each interaction with medical professional, it is a sort of collaboration that you're having, and that each experience does need to be tailored to the client or the patient that you have with you. That was just the experience I wanted to share that I hear is pretty common out here.
I actually wanted to donate blood one day. They were asking just the basic questions and whatnot, and at the time I was with a couple of my friends. I basically told them, I was like, hey, just a heads up, like, I am bisexual, I don't know if that matters. At that point they're like, oh, we're gonna have to probably reschedule if possible, or if not, we'll probably get in touch with you, just because of the fact that we just really don't want to deal with the fact that we have homosexuals in the facility that are wanting to donate blood just for the risk of AIDS. At that point, I was really confused. I was maybe 16 at the time, just because we had one of those blood drives like at the high schools or at the schools. So they're like, if you want to donate, go for it. I don't get it. Blood is blood, if I'm not mistaken. I mean, I don't have gay blood to give. I mean, I'm not going to shoot out rainbows and that's your blood that you're going to get. So I was definitely confused. I was more disappointed because I'm like, wait, I don't get it. I want to help somebody, but I can't help anybody. So how is this going to work? Of course, my friends were, more furious than I was. I was just more bummed out because I just kept looking at myself like, did I do something wrong? Did I cause something to say that, that they're just going to look at me like, oh, no, you're not worthy, or you're not, worth it, and off you go, type of situation. So no, it was a pretty shitty situation, just because I know it felt weird being rejected because of your sexual preference. So at that point, you're like, what do you do? Like, who do you reach out to? I can't go to the principal and be like, hey, I just got rejected because I'm gay. What do I do?
I think it's really important anytime you're working with another individual is to recognize that you are not aware of the trauma that person may or may not have experienced. And if they're making a request, such as something as simple as, hey, can we close the door so we can have a little bit more privacy? Instead of thinking that you know best in the situation, having more compassion for the individual you're working with, and then also respecting your ethics as a physician and understanding the importance of confidentiality and not to become lax with it. Those are some things that I would like to see change in our county and held to a higher standard.
Right now, I'm seeing a therapist who's really understanding and not just, accepting, but is actively affirmative. She really understands a lot about the experience of being LGBTQ, and she is very good at recognizing when she maybe doesn't know as much, and she knows how to ask the right questions about that as well, which is very important. And I just feel like I've gotten so much out of therapy because of that attitude.
So where this idea to wear a pin in my practice came from was a few years ago. My family and I, we had taken a road trip around the country. We had gone to DC. It happened to be during Pride Week. In addition to just being there for an amazing celebration, we also acquired a lot of swag, pins and flags and bags and beads, and my kids got all that they could, filled the bags. And I had put a little rainbow heart pin on my purse, kind of nonchalantly. I liked it. This seemed like a good place. Wanted to wear it. And on our way back to the West Coast, we stopped in the Midwest at some families' homes. One of these families, the family member was really young, like a young, barely, not even teenager yet. And I didn't know it at the time, but he saw this pin, and it meant a lot to him. And later, he told his mom that he noticed it. We did notice that he really interacted with my husband and I a lot, and usually he's just really subdued and quiet. But fast forward to now, or less than a year ago, he's come out as trans and is sharing that with the rest of the family. But I learned, from the mother that this little subtle symbol meant so much to him that he knew he could trust us. And so I realized that that's really important in my profession as well. It's not just who I want to be as a person to express that I'm a safe person, but also if patients don't feel safe going to the hospital or the clinic or their providers, then they won't seek medical care. And if you don't seek medical care, or you don't have good access to health care, we see poor outcomes in health. So I feel it's a responsibility to communicate that I'm an ally.
All right, and Caroline, now that we've heard some from our community members, would you give an overview of the strategic plan, and then let me know when you'd like me to do the more in-depth piece?
Yes, Michelle, hi, and thank you, everybody. My name is Caroline Cerusi from Transitions Mental Health Association. So essentially, the strategic plan is a document that we created. The LGBTQ+ task force of SLO County has over about the last several years. So it's been something that's in the works for a while, based on data collected from the needs in the community of what areas we most needed to address to increase mental health equity across the county. So I'll go into a brief overview for time's sake. Michelle's going to dive in a little deeper into one of the goals. But some areas that we noticed that needed addressing are such as Dr. Better Garcia noted, trainings being very, very necessary to promote LGBTQ+ affirming practices for mental health providers, agencies, community organizations, health providers such as hospitals, doctors, etc. We also want to work to increase support services for LGBTQ+ youth in our area. And so that might be an example of identifying existing resources and learning how to expand upon them. And working with several different agencies, schools throughout the area and whatnot in order to bring a very well-rounded amount of services to let people know that they're out there and also increase access and increase the services themselves. We also want organizations and agencies to be able to identify areas for growth and change to help support LGBTQ+ mental health and wellness. So within different organizations and agencies in the community to really look inward and see what is going well and what needs to be improved and how we can listen to people's voices and really take that information in to make a more safe, affirming environment for people. So those are just a few examples of what's in the strategic plan. Michelle will dive in deeper in just a second. And I will let you know that a copy of this plan will be emailed out to all participants. We would love it if you have time to really dive into the work we're doing. It's a draft, so we want your feedback before we finalize and move ahead with these items. And Michelle, I will leave it up to you.
Thank you, Caroline. So the task force's goal 3 is to engage different sectors of the community in affirming practices. So why is it so important that we consider particular marginalized identities in our community individually? Well, you may have heard some talk about intersectionality. Kimberly Crenshaw of the African American Policy Forum, who founded the study of critical race theory, defines intersectionality as the interconnected nature of social categorizations such as race, class, and gender as they apply to a given individual or group, regarded as creating overlapping and interdependent systems of discrimination or disadvantage. While it is true that we are all human and thus have much in common, it is also true that systemic inequities exist which make it more difficult for those with marginalized identities to get their needs met, and each additional identity compounds the bad. For example, a disabled Black transgender woman faces many additional barriers when seeking care, and this task force wants to help decrease those barriers. Diversity, equity, and inclusion needs to be baked into everything we do, not just added in at the end. We want to appreciate other cultures, visible and invisible disabilities, and more, and embrace them with joy and full access. I'd like to look a little bit more in depth at some of the groups listed under this goal. Don't have time for all of them, but faith-based communities have a wide reach in our society and mean a lot to those who believe. While there are some affirming communities of faith in San Luis Obispo County and others who are willing to receive some training, often LGBTQ+ folks are not welcomed and their mental health suffers as a result. Senior care facilities are a focus because many LGBTQ+ elders go back into the closet when they age and are at significant disadvantage due to lifelong discrimination, lack of family members to care for them, and lower lifetime wages in the case of lesbian couples. It's important that LGBTQ+ specific sex education takes place in schools, in addition to ensuring other kinds of equity for LGBTQ+ students, who we know both from the California Healthy Kids Survey and the Qcares survey are doing worse in our county than in the rest of California. We need to develop the cultural humility to access communities of color, disabled communities, and others, changing our organizational cultures and being open to not only giving people a seat at the table, but listening to them and working to create equity for all. In conclusion, the purpose of Goal 3, engaging different sectors of the community in affirming practices, focuses on making sure our diversity, equity, and inclusion work leads to a sense of belonging for all LGBTQ+ individuals in San Luis Obispo County. We aim to embrace and uplift intersectional differences as we make sure no one is left behind. Thank you.
Thank you so much, Michelle, for that overview and for that deep dive into that particular area of the strategic plan. I really want to encourage all of you to take a look at the strategic plan and to really give your input. The task force has worked tirelessly on this for the last year and a half or so, really wanting to identify how we can put into action the findings that Dr. Better Garcia's study highlighted, and how we can truly make San Luis Obispo County an affirming and safe place for all people. Thank you, Michelle. All right, with that, we are going to be moving into our panel, and we have folks that are a part of our task force who are going to be highlighting the different organizations that they represent, and particularly highlighting what they are doing to be affirming and welcoming to all people, in particular those who identify as part of the LGBTQ community. So with that, and just as a reminder, they're going to be giving a really brief overview, about 2 minutes or so. If you have questions specifically about someone's presentation, please put them in the Q&A, and we will do our best to try to get to them all. And everything that's not answered, we will be sure to reach out to you and get you that information. So with that, I would like to introduce Serena Ruggles with the Gala Pride and Diversity Center.
Hi, my name is Serena Ruggles. My pronouns are they, them, and she, her, and I'm the center coordinator for the Gala Pride and Diversity Center. So we are a 501c3 nonprofit located in downtown San Luis Obispo. We're right across the street from the courthouse. And our mission is to support and empower people of all sexual orientations, gender identities, and expressions to strengthen and unite our Central Coast community. And we do this in a number of ways, probably the most community connected of which is our support groups. So we host a number of support groups, some of which happen weekly, some of which happen monthly, and most of which are happening virtually right now. So we have a senior advocacy group that has just restarted virtually. That's been very exciting to watch. We also have Trans Tuesday support groups, and that is hosted by Trans Central Coast, which is a wonderful group of Gala. I think they're presenting later on today. We also have our Q youth group starting up again. That's for ages 13 to 19, and they meet weekly. We have Slow Lesby Friends. We have the Walt Whitman's Gay Men's Book Club. We have a LGBTQ plus AA meeting, as well as polyamory discussion groups, BDSM discussion groups, and a eating disorder support group as well. We also recently, with the support of Stoke the World, have been able to bring on a therapist. Rocio Anaya is a new therapist with us. She currently accepts SENCAL, and she is bilingual and LGBTQ plus affirming. We are also, of course, very involved with the Pride celebrations that happen in San Luis Obispo, and we're coordinating with the Cal Poly Pride Center this year to put that on. And we're very excited about that. We've got a lot of great virtual events coming up. When we are open once again, we have meeting rooms and things like that, meeting rooms as well as a beautiful library that is available by appointment right now.
Thank you so much, Serena. So many resources over at the Gala Pride and Diversity Center. With that, I want to hand it over to Tanya Leonard with Questa's Student Health Services.
Hi, everyone. Thank you. I'm so happy to be here tonight. Yes, my name is Tanya Leonard, and I'm with Questa College Student Health Services, and I am a therapist there. I'm a licensed marriage family therapist. I'm just going to share a little bit about what we're doing at Questa to be an affirming community and environment. I want to be clear that it is a work in progress, and I think we need to continue working on it, but we have been making changes throughout the campus, and I feel good about that, but we need to keep working. But some of the things that we've done to help to become an affirming environment, and I want to say becoming, because I think we still have a lot of work to do, is changing our forms, making sure that we're advocating that people on all of their forms ask for the pronouns students would like to be referred to. We do have now, even on our application process, ability to put the name that you would like to use, even though you may have to put a legal name on your application. You can go in and change that so that you can put the name that you want your instructors to call you by in your class, and this faculty and staff that are helping you. We've updated our medical forms so that they are asking your sex assigned at birth, your gender identity, and your sexual identity, so that your provider will be clear with that information. All of our nurses and our mental health staff have been through basic safe zone trainings, and to help support them in being LGBTQ plus Affirming providers. I am part of the Slow Acceptance Project, which I'm super excited about, and it's been a really great learning experience and still very heavily involved in that. I'm in the current program. And then we have advocated for gender neutral bathrooms, which we have throughout the campus. And we have a website that will tell students where that is at, as well as it's a website for LGBTQ+, and it has resources available in the community. Gala's there, Trans Central Coast. We have local resources, but also on campus, a list of providers that have been through safe zone trainings and services that are available through our health center and other community services for students. So they can go there and find out who they might go to feel comfortable. So also we have recently, we now have a Cuesta Pride Club, which is nice. We didn't have one for a while, and now we have some students who are back involved and have started a new Pride Club. So that's really fun. Students can get involved with that. And our cultural center is doing a lot of activities to help recognize LGBTQ+ communities. So we have that, and we also have, which I think is a nice thing that we haven't had for a long time on our campus. We have not had this, but we have an Introduction to Queer Studies course, which is now part of our Social Justice Studies degree. So that's nice that we have that available now. It would be nice if we have more than one course eventually, but it is a start. So lots of, I think, positive changes moving in the right direction. I think we still have a long ways to go, but we are trying to do some things to make sure that we are affirming. And also, I mentioned our nurses and our health center staff have been trained, but we have brought speakers and trainers on campus to train our faculty and staff too. So it's not just our health center. Our health center, we very much focus on that, and we have not only been trained on campus, but have participated in workshops and trainings off campus that have been offered in the community. But we have also brought speakers onto our campus to train our staff and our faculty, so they have the opportunity to do that. We'd like to see more of that happening. So that's us, I think, in my 2 minutes.
Thank you so much, Tanya. It's so encouraging to hear all of the steps that that Cuesta is taking, and then that also that you are viewing it as a never-ending journey and that you always want to continually improve. So thank you for spotlighting that.
I want to make that clear that this is, I almost feel, I don't want to celebrate this so much in that it's a little bit. We need a lot more, but it's a start.
Thank you. And now we are going to hear from Mark Lisa, CEO of Tenet Health Central Coast. Welcome, Mark.
Good evening. Thank you, everybody. And what a great program so far. And who doesn't like to listen to Dr. Better Garcia? The presentations are always fascinating to me and always eye-opening to me as a healthcare administrator. I am an ally. Tenet Health Central Coast is an ally. We started this journey several years ago. It began as a personal mission of mine, and understand I'm a healthcare administrator. Also, was a 20-year veteran of the United States Navy, and I feel like I took an oath to fight for freedom and equality, and I feel like we're still doing that. You can be very proud of Tenet Health Central Coast's 2 hospitals, Twin Cities in Templeton and Sierra Vista, right here in SLO. We are the only 2 hospitals on the Central Coast that have earned the designation of Healthcare Equality Index LGBTQ Healthcare Equality Leaders. What that means is that the national benchmarking tool, the HEI, which is a function of the Human Resources Campaign, has evaluated both of our hospitals in terms of policies, practices, and training related to equity and inclusion for all of our patients, for all of our visitors, and for all of our staff. Over 1,700 facilities are so evaluated nationwide. There's about 91 that are leaders in California, and I'm proud to say we're the first and only two on the Central Coast. As Tanya said, everything is a work in progress, and I feel that we have never completed our journey to be fully equitable and affirming and welcoming. Every day, it's progress on that journey, and that's what we intend to do. You have a flyer. I believe there's an electronic flyer that Whitney Gordon has sent out to everybody. Hopefully you'll get that. And we're even doing things right now like providing HIV post-exposure treatment in both of our emergency rooms. So in certain situations, following evaluations, if it's appropriate, our physicians will prescribe that very first dose of the PEP. We have mandatory training every year for our leaders, as is required by the HEI. And we're proudly affirming and proudly welcoming. We're not perfect. It is a continuous journey, but we're working to change generation after generation of beliefs into something greater so we can all celebrate everybody and we can come together as Americans, as a people, as Central Coast residents. Tenet Health Central Coast, our hospitals, our physicians, our staff, our allies, and we're here to serve the LGBTQ plus community, but everybody is equal under our eyes. And ask Doug Hoyman, who sits on our Tenet, our board at Twin Cities. Doug will tell you, one of the first things I said to Doug was, we all bleed red. And I firmly believe that. I am an ombudsman for our LGBTQ patients. My cell phone number, how many CEOs do you hear give that out? My cell phone number is area code 209-401-7491. 209-401-7491. Call me if you have a concern, have an issue, have a question, and I'll get you to the really smart people that I work with to help answer that if I can't answer it. And one final thought, I do need to disclose that, and I appreciate what Tanya said about Questa, that they're developing forms now to include not just the binary, but other all genders. We haven't gotten there yet in Tenet Health, and we deal with a lot of federal and state and insurance company paperwork, but we're working towards that. And that's one of those areas where we're not there yet, and I'm trying. And thank you for your time this evening. Thank you for just a fascinating experience this evening. So with that, I'll turn it back to you and go ahead.
Thank you so much, Mark. I just really want to comment that well, speaking for myself, and I'm sure everyone else, really appreciate the humility and the transparency, and that this is a journey, and that none of us are perfect, but we're working to get there, and also that open communication. So thank you so much. I'm sure all of our attendees watching are very much appreciative of that.
I'm an ally. Thank you very much.
Thank you, Mark. And with that, we're going to turn it over to Sam Bird with the LGBTQ Campus Life Pride Center at Cal Poly. Welcome, Sam.
Hello, everyone. Can I share my screen?
You are on screen.
Oh, okay, great. Hi, everyone. My name is Sam. I use any pronouns, and I am the lead coordinator for LGBTQ Campus Life at Cal Poly. I oversee the Pride Center on campus with a group of student assistants. And our goal in LGBTQ Campus Life and the Pride Center is to create a Cal Poly that is radically inclusive of all students, regardless of sexual orientation, gender identity, and expression. We really want to ensure that students feel like they belong on our campus and that they can thrive. And you can see that even we've been working a lot with our partners at the Gala Pride and Diversity Center. We're trying to streamline our mission statement even, and with that we support and empower students of all sexual orientations, gender identities, and expressions to strengthen and unite our Central Coast community. Our area serves about 2,535 active underrepresented SOGI students. That is about 93% of, or 93% of all incoming students actually disclose their SOGI data to us. And so we know it's a little bit over that, but that's a lot of students on our campus. And in our area, one of the things I really want to do is help advise the university on policy, praxis, and procedures, and also provide individual advocacy and consultations with students to help them navigate this campus across all of these different areas, from the university's commitment to inclusion and inclusive policies, academic life, student life, housing and residence life, health and well-being, campus safety, recruitment and retention, and our work with our San Luis Obispo partners. So we have programs, services, and partners with folks across all these areas. We have amazing faculty on campus, like Dr. J. Better Garcia, who's leading a lot of the work in this area. Yeah, so we have folks on our campus that are really striving to make Cal Poly an inclusive community. We know that many of our students still struggle in this area, both on campus and in San Luis Obispo. We are hoping that through our efforts in any way possible that we can help transform the campus climate, the local community climate, to be one where students actually feel that they can come to Cal Poly and get an amazing education and the learn by doing experience, and then go off into the world and do great things. So some other things we do, we provide student leadership opportunities. We have a leadership council now of over 30 representatives representing all of our colleges, a lot of affiliated organizations, and some campus partners that are looking at access, equity, and inclusion in all of our campus spaces, and really striving to move our campus forward. We connect students to affinity and support groups, whether those be the ones that we curate on campus ourselves or within our collective of resource centers, or those that are happening in the community. We host a lot of signature events. In the fall, we focus a lot on LGBTQ history. In the winter term, we focus on leadership. And in the spring, we do a lot of work around Pride. And as it was mentioned earlier, our students are very excited to be working with Central Coast Pride now. Let's see, we work with housing to provide residential learning communities. So we have 3 first-year experience in the Yaqui Tutu Residential Complex and Pride Leadership and Pride Transfer communities in the Poly Canyon Village. Those, because of COVID, those are not quite up and running this year, but we are planning to revisit that as soon as the pandemic allows us to be able to do that and actually host the groups. But we work with housing to do assignments, and we are looking to actually queer more spaces by developing a Pride Commons as well, just a hangout space where students can study and be in community, have access to a kitchen, all of that. So, and we are, I do a lot of consulting both on and off campus, and we connect students to gender affirming care. So we're very excited about that. And I'm going to turn that portion over to Dr. Kimberly Andridge, who is on the call. But if you want to learn more about LGBTQ campus life, you can visit us on our website at pride.calpoly.edu.
Thanks so much, Sam. Thank you all for having me here tonight. My name is Kimberly. My pronouns are she, her, hers. I'm a licensed clinical psychologist in Campus Health and Wellbeing's Counseling Center. So like Sam mentioned, I'm just going to highlight a little bit about some of the work that we're doing over in Campus Health and Wellbeing. And as others have echoed, this is always a work in progress. It's been a work in progress the 6 or so years that I've been with Campus Health and Wellbeing, and of course will continue to be. So we've done some similar things around changing forms expanding trainings for all of our staff, all of our both medical, mental health, well-being providers, as well as our administrative support staff, in order to really create a space that's more affirming for our marginalized and underrepresented students. Speaking specifically to gender affirming care, just recognizing the time. So we have a gender affirming care team, which is it's a group of providers both within medical and mental health services who've identified that providing gender affirming care is a vision and a commitment for them. And so we are committed to ongoing training, ongoing continued expansion of our services, and really creating an affirming space for our trans and non-binary students. On the counseling side, that looks like individual services, partner services, group services. We have historically offered an LGBTQIA support group, and we are expanding to offer a trans and non-binary support group as well. We've received some feedback from students that that's really something that our trans and non-binary students would like. So we're moving forward with that. We also do a lot of letter writing. With our hormone services in our health center, those follow an informed consent model. So our providers don't require letters for anything like that. Thank goodness we've moved away from that. But surgeons may require letters for surgical procedures. So we provide all of those, any sort of other documentation that students need. And we really follow an informed consent model. We really want to reduce any barriers and not engage in any sort of gatekeeping or minimize the gatekeeping. Our services are also free, which I think is really important for anyone who's a student to know, because some of our students really struggle with accessing care offsite from a financial perspective as well. So on the health services side of things, we are offering hormone therapy, masculinizing, feminizing hormones. We also offer PrEP STI screenings, gender affirming cancer screenings. So the list kind of goes on, but the goal is always to continue expanding and looking at what we're doing and looking at what we can do better and where we can continue to improve. We are currently going through an institutional review of campus health and well-being, the services that we offer, the processes that we offer. Shout out to Dr. Brad Garcia, who's spearheading that for us, because we know that there's always something that we're missing. There's always something that we can do better. I think that pretty much kind of captures it.
Thank you so much, Kimberly. That is really, as a Cal Poly alum myself, and I'm sure so many more on this fund, it's so encouraging to see that so many of our entities and agencies in this county are really striving to do everything that we can to support everyone. So thank you. And with that, I'm going to hand it over to Taryn Little with RISE.
Hi, everybody. My name is Taryn Little, and I am a licensed clinical social worker, and I'm a clinical supervisor at RISE. And as some of you may know, RISE is a nonprofit organization, and we offer services to survivors and their families of intimate partner violence and sexual assault. Our services include crisis intervention. We have domestic violence shelters, SART, sexual assault response teams, court accompaniments, restraining orders. We have community outreach education department, and in our clinical department, in our therapy, we offer individual, group, and family groups. And, I will say that RISE also is a group or a work in process. I mean, the agency takes very much how important it is to learn education. And recently, along with Stand Strong, participated in a training that Gala put on. Thank you, Gala. It was absolutely wonderful. And with that, they are continuing. Our forms have changed to now, instead of sex, it is your gender, it is your sexual orientation, pronouns. And because I also identify as queer, and my pronouns are he, she, her, and hers, I've been out since I was 24 and moved to West Hollywood. And as you can tell, I'm only 30 now, so that was only a couple years ago. Seriously. I can speak mostly about what happens in the therapy department. RISE represents diversity within our staff. We represent LGBTQ plus within our own staff and within our own people that we serve. Within our clinical department, we have therapists who identify as queer and trans. And we take it as very important because a lot of our therapists are young. They're either in school or freshly out of school and not licensed yet. And what we realize is what's taught in school, or even the therapeutic techniques that are used, are basically heteronormative, cisnormative, heterosexual. And it's very different if someone who is queer, gender, trans is very different from a lot of times the practices. You know, for example, if a straight hetero woman is raped, her reaction may be very different from a lesbian woman who's raped, or a trans person who's raped. Some of the grounding techniques of focusing in on your body and being at home in your body can be great if someone feels at home in their body. But for someone who doesn't feel at home in their body, particularly a trans, that would be creating even more trauma. And that is something that a lot of therapists say, yes, they're affirming and yes, they understand, but there's so much that they don't know. The dissociation, which might be seen as a maladaptive skill for some people who are trans or queer or any other non-binary, that actually dissociation could be a life-saving skill. You know, so it's, you know, what is taught clinically and what happens in practice is very different. And I know at RISE, because we do have queer staff, trans staff, therapists, that we take it very importantly, kind of one therapist at a time, see if we can hand out people a little bit better. We have started an LGBTQ intimate partner violence group. We do have individual clients who identify anywhere along that spectrum. And it's a work in progress, but it's work we take very, very seriously.
Thank you so much, Taryn. Again, I'm really hearing just so much. Every agency is just really striving to do the best they can, but to always continuously learn and to hold themselves accountable too, is what I'm hearing for our community, and to make this a safe place for all. Thank you so much, Taryn, for sharing that.
Thank you.
And now we're going to move over to, and I apologize, Jitsibe, if I mispronounced your name, Sandoval, a legal advocate with Stand Strong. Welcome.
Yes, thank you. You pronounced it perfectly. So yes, my name is Jitsibe Sandoval. I am the legal advocate over at Stand Strong. I use she, her, hers pronouns. And I work at Stand Strong, whose mission is to end domestic violence and to support survivors, all survivors in San Luis Obispo County. We offer an array of services, free trauma-informed services that support survivors of intimate partner violence. This includes counseling. We provide one-on-one therapy and occasionally offer the processing groups that are tailored to the LGBTQ plus community. Other services we provide are housing services. So we help address the housing need. We have advocates that help with housing. We also have a shelter, so we have a confidential safe house. We have a legal department that has 2 staff attorneys, and we have a department that's dedicated to prevention. And the idea is that intimate partner violence and domestic violence really affects everyone. So at the initial contact, when a survivor comes to access our services, we do ask their pronouns so we can ensure that, you know, we're respecting their gender identity. And our goal as an agency is to do our part in creating an inclusive environment. In order to meet these standards, we constantly reassess our policies and procedures so that we can reduce stigma and barriers to accessing services. In order for us to provide the most up-to-date supportive services, we attend trainings, we participate in community events, we review our client satisfaction surveys to address the needs of people we serve. And we recently covered our flags with pride flags. So we have the rainbow pride flag, the bisexual pride flag, the pansexual, and the transgender flag. And we have them flying all over our offices so that we can provide that emotional safety component by creating that visibility. And we want to have a safe space, not only for our survivors, but for our staff as well. Going into the work with the idea that the LGBTQ plus community is disproportionately affected by intimate partner violence and are more likely to face barriers in accessing services can really shape how we interact with survivors. Knowing the statistics really reinforce the need for our services. For case in point, 2013, the CDC, they found that lesbian, gay, bisexual people experience intimate partner violence and sexual violence at the same or higher rates as heterosexual people. And transgender survivors are more likely to face threats, intimidation, and harassment and police violence as a result from intimate partner violence. And knowing this information really helps shape our work. And I'm honored and grateful to be part of this ever-evolving movement. So thank you so much, and I really do appreciate all of this.
Thank you so much, Jasibe, for highlighting everything that Stand Strong is doing to not only be an advocate, but to help change our system. Thank you. And we have one final panelist, last but certainly not least, to give a shout out to technically, I think, a former supervisor of mine, Jill Richens. Welcome. Jill is a division manager with San Luis Obispo County Behavioral Health.
Yeah, thanks, Elisa. I think we qualify as friends now, don't we? Like legit?
I think so.
Okay. Former supervisor, current friend. Anyway, like Lisa said, my name's Jill Richens. My pronouns are she, her, hers. I am a licensed marriage and family therapist, and I'm the division manager for Behavioral Health's Youth Services Division. I'm also a member of Behavioral Health's Cultural Competence Committee. So this evening, I'm representing both the Cultural Competence Committee and Behavioral Health. As you may know, Behavioral Health, we provide trauma-informed, inclusive, and affirming services. And as everybody has really said, and I feel like we're in the same boat, we're striving, it's a work in progress, as so many of you have shared, and we're moving forward with what that means to be truly affirming and inclusive. But those services that we provide are prevention services, substance abuse treatment services, specialty mental health services, and crisis services. We work with youth and adults, and we have clinics throughout the county, as well as working with individuals in the community, in schools. We have a Latino outreach program. We work with people when they're getting off of work late at night. Our teams, we really work to have strong, well-trained teams of people, from the front desk individual to our therapists, our doctors, our medication managers, who are mindful of the challenges facing the LGBTQ community. I can say, just as a previous therapist working in youth services and now a manager, we're really seeing more and more kids coming forward with gender identity, sexual orientation issues that they want to talk about and be open about. And I'm watching my staff just wanting to grow and to learn move in this direction. We have a number of clinicians who have participated in the Slow Acceptance program over the last year, and trainings. We are always looking for trainings on clinical issues related to sexual orientation and gender identity issues. So with that, that's not my only thing, because I wanted to say that the other thing we really strive to do is create an environment that is inclusive and affirming. So like so many of you have spoken about the forms, we're working towards updating our forms to recognize the full spectrum of gender identity. We're cognizant of the signage in our clinics and our offices, and are always trying to move in the direction of growth and improving ourselves in the work we do to help our clients in the community. So thank you.
Thank you so much, Jill, for that highlight. I will have a few more things to say about slow behavioral health in a moment, but I want to hand it over to Caroline.
Hello. Hi, it's me again. So I just wanted to wrap up a little bit of what we discussed here tonight. I'm so glad that so many of you showed up. I wanted to speak a little bit on behalf of the task force. I'm currently one of the hats that I wear at Transitions Mental Health Association here, a local nonprofit mental health organization serving all of San Luis Obispo County and Northern Santa Barbara County. We have over about 40 programs working to assist individuals and family members through their mental health recovery. And so one of the things that I do here is work to lead, which is a strange term because everyone really feels like we're all leading it here, but the LGBTQ plus mental health task force. So with everything that you've heard tonight, I just wanted to put it out there that we really want to be working with the community. We have so many community members involved already, and we love to just continue to hear more feedback. So like we said, we will be sending out that strategic plan. We would love it if you would be interested in reading it over, giving us any ideas, anything, any feedback really that you can provide to help us be as effective as we can be in this community would be really wonderful. We also have opportunities for you to join our task force. So we meet the last Friday of every month. Our next meeting will be Friday, March 26th. From 1:30 to 3 p.m. So with all the information I'll be sharing with you afterwards via email, you'll have information of how to get involved with that as well. So Elisa, I believe you're last.
Thank you so much, Caroline, for highlighting the task force. I just want to say a sincere thank you to everyone who tuned in this evening. This is really for our community. This is for all of you, for San Luis Obispo County residents. Want to do a special shout out to Transitions Mental Health Association and the Gala Pride and Diversity Center and Slow Behavioral Health for helping to make all of this happen. Just to add on, this is funded in part by Mental Health Services Act money, specifically prevention, earlier intervention. And because of MHSA, if you aren't familiar with it, go look it up. But our county does a fantastic job of engaging stakeholders in that process. And it was because of stakeholder engagement that projects like the needs assessment that Dr. Better Garcia shared with us and other efforts like this task force happens. So just to really give a shout out to Slow Behavioral Health in all of their different divisions for really being a champion for the LGBTQ community and wanting to strive to be better in all that they do. I also want to thank the Growing Together Fund of the Slow Community Foundation for helping to support this. And to all of the panelists that took their time to be here tonight to share about their organizations and to really bring a degree of authenticity and transparency to what they're doing well and what they can improve on. And I really appreciate that. The biggest thanks to all of our task force members who have helped put this together, who have been with the task force not only from the beginning, but have also just jumped in and provided their input and really helped make this a well-rounded, engaging experience for all, and to make sure that all viewpoints are brought to the table, because we know LGBTQ individuals aren't, we're not all just in one area. There are so many different intersections in our identity, and it's important that we capture and are here for everybody. So with all of that, I will say good night to you all. And I hope you have a wonderful evening. And please be on the lookout for a follow-up email from Caroline. There will be a survey about this event because we always would like to strive to make these better, as well as all of the resources and contact information from all of the individuals that you heard this evening. So thank you all, and I look forward to seeing you all soon.